He was a morbidly obese surgeon destined for an operating table and an early death. Now he's a rebel MD who is fabulously fit and fighting to make America healthy again. This is Stay Off My Operating Table with Dr. Philip Ovadia.
It's the Stay Off My Operating Table podcast with Dr. Philip Ovadia. Thanks for joining us. Our guest today is Dr. Scott Vrzal, who doesn't have nearly enough nouns in his name. What's the ethnology of VRZAL?
Right. The name is a Czechoslovakian, Czech Republic
Oh,
name.
yeah, they don't have
Yeah.
enough vowels. Is that because the communists just destroy all the vowel factories? I'm sorry. I'm taking us off track.
Already
Phil,
off track.
Phil, I'm going to turn it over to you.
Sounds good. We're excited to have Dr. Scott Vrzal on the program today. Dr. Vrzal is a chiropractic and is the author of the book, The Headache Advantage. And we certainly want to talk about headaches and some of his, I think, somewhat unique chiropractic methods that he uses as well, and just his general take on health. So before we jump into all of that, Scott, why don't you give your background to our audience? Maybe let us know why you got into chiropractic and what led you to focus on headaches.
Okay. Yeah. I mean, my story is almost the opposite of yours. I've been basically a health fanatic from the very beginning. Started out in, natural bodybuilding and working out, and actually before that, early teens, I was going to Winchell's before and after school and eating the biggest donut I could buy with my $2 or whatever it was. And then I'd of course, get into trouble when I got to school and lit firecrackers in the class and made some silly choices like that. I was diagnosed hypoglycemic when I passed out at a big event. And so then I realized shortly after that, anytime I ate sugar, it didn't bode well for me and I'd get into trouble or I wouldn't perform my best. So swore off sugar at 14 years old. And as I mentioned, got into working out, bodybuilding, natural bodybuilding, drug tested, and then started having headaches. And so as I had these headaches, at the time, my headaches were a whole headband type of a headache, would come on, especially if I did any bench pressing type movements. Went through the medical model. They said, you might have an aneurysm, don't work out, and the typical scare. And it turned out I didn't have an aneurysm. So they said, go see a psychiatrist. Told me I was crazy, right? Because they didn't see an aneurysm. Ultimately ended up in chiropractic. A chiropractor had helped me out. So as I got into chiropractic and took it on as a profession, I mean, really the first time I got adjusted, it was like, man, I just felt great. Felt like the whole world had come off my shoulders. Thought, man, I want this for myself. I want to be able to help others feel this way as well. During chiro school, I took a position in one of the clubs to bring all the leaders in the field on campus. Applied kinesiology turned out to be the most profound tool I could find, which looks at muscle organ correlations. So every muscle has an associated gland or organ with it, which goes into, cardiovascular. The muscle associated with the heart is the subscapularis muscle, one of the rotator cuff muscles. That's part of why the left arm shoulder referred pain comes along with heart challenges. We can talk more about that. But so as I learned these muscle organ reflexes and reflex points for all the different glands and organs, it gave me a tool to identify what the triggers were. Again, because I got into healthcare for the headaches I had. So anytime somebody had a headache, my first question was, where does it hurt? And so then I would look at, and it turned out that virtually every headache was referred pain from another gland or organ in the body. And so that's how I ultimately came up with the tools to figure out what these triggers were.
So I'm going to have to admit that, reading your book and just hearing you say it now, right? This was the first time that I've heard that, most headaches are not a problem with the head. It's coming from somewhere else. Maybe talk a little bit about that.
Yeah, that's why they've been so elusive, historically. I mean, even some of my most cherished mentors said headaches are tough, and to flip that around a bit, I've had patients with tumors that have actually shrunk using these same protocols, side of brain tumors that shrank by correcting gallbladder problems, or pituitary tumors that shrank by healing the pituitary, which is another type of what I call cyclops third eye type of a headache. So those are the rarities. Those are possibilities. But just to kind of make the point that even correcting these underlying 7 areas of dysfunction that I outline in the book, there's 7, it whittles down to whether you want to call it a cluster headache or a migraine or any of that stuff. It's all about location. And so some of it has to do with acupuncture. A lot of it has to do with acupuncture meridians. Some of it has to do with the physical muscle manifestations of the thyroid. Hypothyroid will cause a tension headache. And so we look at what is causing the thyroid to not function. And then really the reason the book is called The Headache Advantage is because the advantage of head pain is it tells me really what the priority is for the body, right? So, if they can have a list of, cardiovascular and digestive and a bunch of other symptoms, but wherever their pain in their head is going to tell me what the primary weakness is. So then I can address the gallbladder and know that's going to take care of their, nitric oxide problems and their digestive problems and their fat metabolism concerns, as well as get rid of their headaches.
Wow. This is fascinating. The muscle and organ connection.
Yes.
Expand on that idea a little bit. And I think the heart and the left arm is probably a really good place. Complete ignoramus like me to starting to understand.
Yeah, for this audience. So backing up, originally this Dr. Goodhart, the late great Dr. Goodhart, identified this in the 60s when he had the delivery boy, had wing scapula, and Dr. Goodhart had a bit of a sense of humor. And so the kid had come to make deliveries at the office, and he'd say, "Oh, how's your back?" And he'd say, "Oh, my back's great, doc, but I still have this wing scapula," and kind of make a mockery of him in the office.
What's that? I don't know.
Oh, thank you. Okay. So where the shoulder blade kind of raises off, the shoulder blade doesn't stay connected to the rib cage properly, and so they kind of sticks out a bit. Now, ultimately, there's a muscle called the serratus anterior muscle that holds, when it functions properly, it holds the shoulder blade against the rib cage. It's a big stabilizer for the shoulder. And so Dr. Goodhart didn't take lightly to being, made fun of in front of his patients. So he had gotten a book by Campanji about muscles and the function of them and, their origin and insertion and so on. He realized that the lung acupuncture meridian went right through that serratus anterior muscle. So then he realized he was able to extrapolate that healing the lung, doing whether it's nutrition or emotional work or adjusting the nervous system to allow the lungs to function better, then the muscle would function properly. It would be facilitated. It contract as it should instead of being conditionally inhibited and functionally weak. And so that opened this whole, Pandora's box of all these options, all these opportunities to identify weaknesses in the body, identify organ problems and correlate them and extrapolate that into organ dysfunctions and then physical manifestations as well.
Okay, give us some more.
So we talked about the heart. There's a couple of options, a couple of reasons that heart manifests or, refers down the left arm. The subscapularis muscle, the muscle that is just underneath the scapula, the shoulder blade, it does the internal rotation of the arm. It's really, when it's not functioning properly, it gets hard to get the arm up over the head. When that is one of the 4 rotator cuff muscles. When that one doesn't function properly, then I'm looking at the heart. I'm looking at why is the heart not functioning properly. Often that's a contractility, the ability of the heart to, contract and move blood as it should. So then when we identify these areas of weakness, say like the subscapularis muscle, then I'm looking at whether is it a structural problem? Do they need, an adjustment or work on the muscle itself or that sort of thing? Or is it a chemical toxicity? Is arsenic compromising the way that the muscles work, or pesticide or something like that? Is it a nutritional deficiency? Vitamin B1, the good source of thiamine, is profound in cardiovascular issues because that helps bring tone to the valves. Mitral valve prolapse, for example, is very typically related to the need for thiamine. And then there's B4 also that fits in there. Getting a good source of thiamine. Is there a nutritional deficiency? Is there emotional deficiency? There's emotions associated with the heart that tend to be like muddled instability, frightfully overjoyed, paranoid. Did they have this heart issue ever since they had, this overwhelm, that kind of thing. So we kind of can put all that together through the muscle testing, through the pain patterns, through the history, if we need to do labs or that sort of thing to really get to laser in on what's going on, then we can, or we do.
Okay, I'm fascinated.
Yeah. As a chiropractic, people guessing primarily come to you with musculoskeletal complaints of some sort. And how often, I guess, do you find these associated, we'll call them organ problems, or how often do you find that the problem isn't in the muscle itself? Sometimes it is. It's a pulled muscle, or it's, they've injured themselves in some way.
Right.
But give us a sense of, how often it's not, and it's really just an indicator of something else going on in the body that needs to be discovered.
You sitting down? 100%. I mean, I know it's a big, bold statement, but low back pain, it's because I, picked up my child, that sort of thing. The quadratus lumborum muscle in the low back gets weak when the colon's not functioning properly, for example. So then they pick up their child and the muscle did not contract properly, did not fire. And that's when the problem becomes, or they're working out at the gym or, did their low back exercises. So when I fix the colon, whether that's emotional corrections using large intestine 4 acupuncture point to help it function better, helping them identify the food triggers, whether it's dairy or wheat or something like this compromising their colon, that pain will literally be gone before they leave the office. So that's really where my confidence in writing the book, for example, identifying these 7 patterns, a headache never leaves my office. So that gives me the utmost confidence that it is a gallbladder that causes the right-sided head pain. It is a stomach acid deficiency that causes a left-sided headache, because I can change that in a treatment setting, and they leave without it. Then regardless of what research says, I know, unequivocally that is the trigger, the cause.
I kind of like that last statement you made, regardless of what research says.
Right.
I have an old mentor, and he was talking about a completely different context, but he said he used to tell me an ounce of experience is worth a pound of theory.
Yeah.
And I hear that same idea there with you. I do this in a clinical setting, and the patients walk out well.
Part of my dream
may or may not say.
Yeah. And, obviously doing my due diligence for the book, I looked as much as I could to find any other correlations, in the published peer-reviewed research that correlated, stomach concerns with left-sided or frontal headaches, or, gallbladder. So part of my dream with getting this information out with the book is that now hopefully people can prove me, I do a HIDA scan for the gallbladder, do studies to look at how the gallbladder is functioning, and then recognize that everybody with the right-sided headache has a gallbladder problem. I mean, to tie that, to get a little technical and kind of tie it into this audience, most of the people that listen to this are concerned about cardiovascular problems. So the risk of the right-sided headache is acetylcholine is the brain's control of the gallbladder. And so if the gallbladder is compromised, then we end up deficient in acetylcholine. Acetylcholine is a precursor for nitric oxide. And so if they are deficient in nitric oxide, and NAC is N-acetylcysteine, so it's NO, nitric oxide, like nitrous, right? That somebody's, the good doctor might give somebody that's having a heart attack. The acetylcholine is a precursor to nitric oxide, which dilates the vessels. And so if they're having an anxiety type or a constrictive type of a cardiovascular event, we need to open those airways. And so why is that function? That's a different mechanism than somebody that has plaquing or plaquing of the arteries. That's a different discussion. Where I was going with that, though, is that right-sided headache could be an early warning sign that, hey, you're not dilating. If they have right-sided headaches, they're probably also going to have high blood pressure because the nitric oxide is not allowing those vessels to dilate, so the heart has to work harder. So we've got these signs that, hey, make some lifestyle changes, and that's why I'm excited to be a part of this project, in this group, because I'm all about making a difference, helping people identify the early warning signs, like Dr. Vadi is doing, right? And get the information out so that they can say, oops, this isn't going so well. I did, oops, I'm eating sugar. I get into trouble in school. I need to make a change. So.
How old were you when you figured this out about sugar?
I quit eating refined sugar at 14 years old.
That's a long time.
What are you saying? Yeah, no, I was young, yes.
Did somebody figure that? Yeah. Hey, I can say this, all right. Was
Yeah.
that strictly on your own, or did somebody
I
say,
was
hey,
diagnosed hypoglycemic,
okay, okay.
yeah. So again, because I was getting into trouble, my parents took me to a holistic health practitioner. They said, "Hey, if you don't make changes, you're gonna have to give yourself daily shots." I'm like, "Okay, red flag. What's the deal?" And then I recognized, so that was the aha moment. And then I recognized that when I ate my donuts, or I put two and two together, that hey, this food equals this outcome. So I swore it off and never really turned back. I mean, I eat properly, so I don't have carb sugar cravings. There's a lot of other stuff we can talk about in that realm as well.
Yeah, we have lots of people who can do that. I would love, Phil, I can see that right now this conversation go one of two directions. We can keep going down this path with the headaches, or we can talk about some of the other modalities that Dr. Vrzal uses. And I'm totally cool with either. So, what
Yeah,
do you
I think
think?
it would be good for us to go maybe a little bit deeper on the headaches before we get to the other modalities. And I guess, my question always becomes, or my question is around, you've figured out these 7 patterns of headache or locations, patterns around the headaches, and are able to, you talk about in the book how they correspond to the, where the problem, where in the body the problem might lie. I guess, can we really simplify things that much? I'm just kind of thinking through all the different things that can go wrong in the body. And, can we really boil them down to just, sort of 7 patterns? And that really shows us where they're at. And the related question is, I guess, sort of, how common then does headaches become as a presenting symptom of other problems? I know, I guess it's hard to find someone that hasn't experienced a headache, right? And when are they temporary things, and when do they become, when should people be more concerned about their headaches?
Yeah, great question. And yes, statistically, I mean, it's almost 50% of the population, has had a headache within the last year or so. I mean, it's pretty profound as far as the segment that deals with this. And yes, I mean, that's why, again, I called the book The Headache Advantage, because we want to learn from it. We want to recognize what the body's trying to tell us. And in my world, virtually every pain is that type of a warning sign. So we want to look at, oops, when I eat tomatoes is a kind of a surprise food on the right side of headaches for a lot of people. About 70% of the population has issues with tomatoes that will affect that acetylcholine I was talking about, and could set up a right-sided headache. So it's a minor inconvenience. To answer your, when is it a more ominous, kind of problem? When do we need to look further? It's always easiest to look at diet first, right? I mean, it's kind of like your ministry, if you will, that look at what we can do, the lifestyle changes we can make to not end up on your operating table, to not end up having brain surgery or that sort of stuff. I mean, that should be primary medicine, if you will, is look at diet, look at lifestyle first, figure out what okay, nothing else I'm doing is working, maybe there's another trigger. But again, even in those bigger triggers, okay, get evaluated for the big ugly stuff like I did with a, CAT scan and so on. But almost always, it's going to be a referred pain from the gallbladder, from the stomach, from the thyroid, from the pituitary, from the colon. These are or poor estrogen metabolism. Those are the primary triggers typically.
Is there a model for why this pain gets referred?
A lot of the patterns I figured out were from acupuncture meridians. Ultimately, the gallbladder meridian it starts beside the eye, and it kind of does a ram horn pattern down the right side of the head, and then down the neck and the back, and then behind the back knee, behind the right knee through a muscle called the popliteus. So even right-sided knee, right knee pain, weakness in that kind of hyperextension type pain in the right knee is often a gallbladder problem as well. So that's part of what I try to lay out in the book, is with these questionnaires to help people look at, oh, I've got 10 of these 20 different problems. I have a gallbladder issue. And a lot of it is based on acupuncture meridians. The gallbladder is a right-sided organ. Stomach is a left-sided organ. Stomach meridian starts just underneath the eye, similarly kind of dances around the side of the head, and it goes down through the pec muscle. The pec clavicular muscle, the bench, if you will, bench press muscle, tends to get weak when the stomach's not functioning. And so if somebody's trying to bench press and feels like one arm is often lagging, that's typically another sign of poor stomach function or low stomach acid. So that's part of how I figured those key patterns out. And those are the two most primary, most common headaches in school during chiro school.
Gallbladder and stomach.
Yes, yeah. Those are the two most common headaches. In school, they talked about pain, basically what I call the third eye type of a headache or cyclops headache. They had actually called that pituitary swelling. So that kind of got me looking at some of these triggers. And so that did stand the test of time where again, through the muscle testing and even sometimes lab testing, growth hormone deficiency or thyroid TSH, thyroid stimulating hormone deficiencies, those are all pituitary hormones that can be off on a lab when we see these types of headaches. So then we look at what the triggers are. Frontal headaches, the common pattern, where people see the person with their head in their hand. That was the last one. I kind of figured that one out or refined that one as I was putting the book together. That's more stress ultimately inhibiting the stomach lining. Think ulcer. It's kind of that chronic cortisol causes norepinephrine is a neurotransmitter that tends to be gastroprotective. In other words, it helps when that stress hormone, when that neurotransmitter is functioning properly, it protects the stomach from an ulcer type of a consideration. And so under chronic stress, that norepinephrine starts going low. And so the stomach becomes unprotected and refers pain to the front of the head. So that's another fairly common one with our, yuppie type of people that are going to be listening to a podcast like this.
A couple of times so far, you've used the phrase muscle testing.
Yes.
Talk about that. What is that?
So it starts with, again, every muscle has an associated gland or organ. And so these muscles will be what we call conditionally weak, which means neurologically weak, but they're weak because of a condition and because of a problem elsewhere. That problem could be a structural thing. In traditional chiropractic, they might adjust, for the stomach might be T5 so that the stomach can function better. And then that pec clavicular muscle will fire properly. There's also referred pain areas all over the body, which are often acupuncture points as well. And so we can use these pain points, pain areas to identify problems. And those areas of pain will literally go away when we do the right thing. If it's a nutritional deficiency, if I put the right nutrient in their tongue or, expose them to the proper supplement, then that tenderness will go away on the table, go away immediately, telling us that, yes, this is the right thing. And that's profound for inspiring people to take their supplements or to not eat their bad food. We can demonstrate the tension in that left shoulder because if a person eats too much sugar, the pancreas gets weak, then the latissimus muscle that helps keep our shoulders level and square, that muscle will get weak during pancreatic challenges. And so the person's going to end up with a bunch of upper tension on the left upper trap, and that's typically a sugar handling problem. So
bunch of tension on the left upper trap. I just had my daughter over on Friday and my daughter-in-law over on Sunday. Both of them are constantly, for years, we've watched them
Their left trap.
do this, rub their left trap, and each of them have a different story about why it hurts.
Yeah.
But this is
challenge them, ask them to give up sugar for a week or two and see how much better it is.
Wow.
And so, let's go with that example. What's the mechanism there? How does the problems, challenges in the pancreas end up causing, trouble with the trap muscle?
Yeah. So in that case, the latissimus muscle that like lat pull downs, right? If we're doing pull ups or doing lat pull downs, that the muscle there gets weak when the pancreas is not functioning properly. The tricep also gets weak. Carpal tunnel, open up a whole can of worms here, but carpal tunnel syndrome is often a sign of blood sugar handling problems. Symptomatically, we're going to ask that patient, how many times do you wake up at night? Because that's another, objective or symptomatic sign of how unstable the blood sugar is. Certainly now we have A1C and tests and labs like that to do it. To answer your question, where does that come from? A lot of it's because the acupuncture meridians run right through the belly, if you will, and it kind of parallels the muscle fibers of that organ. And then we can look at, nerves specifically to it. Some of the nerves, the spinal levels that might be related are also what they call associated points in acupuncture that are related to almost more specifically than our, anatomical nerve function would be to that organ.
I would love to explore the acupuncture meridians thing more, but I'm afraid that rabbit hole may go deeper and longer than we have time.
Yeah, we want to stay with things that people can take home and use to stay off doctor's table, operating table.
Exactly.
We want to empower people.
Wow. Apologize. I'm about to sneeze. Phil, you may have to take it here for a minute.
I think we may be able to associate that with an underlying problem, but definitely. So
my blood caffeine levels are dangerously low.
Yes. Yes. As we start thinking about, just approaches to health, we'll call them, right? And obviously on this program, we talk a lot about nutrition and its impact on health. And, you're bringing up what almost sound like, they might be unrelated, we'll call them mechanical issues, right, with these organs that are causing dysfunction, perhaps at a remote. But you've alluded to a number of times that a lot of these things do have, nutritional roots to them. So how do you start to bring that together, right? How should people be thinking about, if they have a particular manifestation, we'll call it a symptom or a disease they've been diagnosed with, how do they start thinking about, what should I be looking at from a nutritional standpoint? Should I be going to a chiropractic that understands, acupuncture, meridians and things like that? How do you start to put this together for a kind of more holistic approach to health?
Yeah, great question. I mean, certainly finding somebody that does, applied kinesiology can shorten the learning cycle, but ultimately it could be as simple as doing a journal. Keep track of, oops, I had a right side, let's use a different, because I've talked about right a lot, but tension, headache, and journal everything they ate, or work backwards. Oops, I have a tension headache today. What were the last 3 meals that I've eaten? And eventually something's going to, rise to the surface, if you will, as a compounding trigger. Again, through muscle testing, I try to shorten that whole learning curve to figure out, while they're there that minute that, when you eat wheat, it's going to be a compromise on your thyroid and it's going to set up a tension headache, for example. Using that example, in the presence of a leaky gut or compromised gut integrity, then the wheat protein can migrate through the intestinal lining into the bloodstream, trigger an immune reaction. That wheat protein is identical to the thyroid, for example, and that can set up a Hashimoto's or an autoimmune attack against the thyroid because the body's trying to deal with this too large of protein that has gotten into the bloodstream. That can then set up this tension headaches, and the mechanism there is because of the way the musculoskeletal system reacts to this attack on the thyroid, the scalene muscles get weak. That causes the neck extensor muscles to be weak, and that's that tension headache, pain up the back of the head. That is a thyroid or an underfunctioning thyroid problem, whether it's an autoimmune or Hashimoto's type of a problem, or just simply a deficiency of folate. Folate's a great subject that we can probably burn up a couple of more podcasts talking about folate and methylation and all that sort of stuff. But the activation of the thyroid hormone T4 to T3, in that it basically it helps to activate folate, which then from the cardiovascular perspective, folate is a key player along with B12 in methylation. When we don't methylate properly, then that's going to open the door for higher homocysteine levels, which can lead, be a direct trigger for plaquing of the arteries and, the bigger cardiovascular incident, events later on. So it all comes together. One of your questions earlier, how do we know? And, it's keeping track of, the trigger mechanism, try to identify, every time, like I did, every time I ate sugar, I realized I'd get in trouble in school and I'd play real hard in my racquetball or my sport for 15 minutes and then I'd quit and I wouldn't try anymore. I didn't like that. So I stopped eating sugar. If you eat dairy and your sinuses get, congested every time you eat dairy, then dairy's probably not a good thing for you, or if you keep eating the wrong things, then eventually we keep plaquing up the arteries. And, pain is intended to elicit change. Pain is the body telling us that something we're doing is not functioning right. And so we want to, and that's what, part of what I'm trying to lay out with the book, part of what a lot of what you're trying to do with your podcast is help people understand what they're doing, the outcome of the choices, lifestyle choices that they're making. Try to learn to listen to, I mean, if they get nothing else from this, learn to listen to what your body's trying to tell you, because it is giving you signs and early warning signs before a catastrophic event.
What I'm interested in is I'm sitting here talking to a chiropractor. We've talked for about 40 minutes, and you have not one time said anything about you. I take it back. You did once mention one single chiropractic adjustment way of dealing with this with pain.
Yeah.
Chiropractors have a bad reputation, personally, I think undeserved, but you will often find amongst the more degreed class,
Okay.
they look down on chiropractors. And yet
Mhm.
I'm hearing you here talk about health from a whole body standpoint in a way
Mhm.
we seldom ever hear from any specialist. Did it start that way for you? Or did you start with primarily being a guy who did chiropractic adjustments and then began picking all the other bits up? My real question is, how did you end up here dealing in all this other stuff that, as far as I know, is a chiropractic?
At its root, D.D. Palmer, that started chiropractic, looked at structure, nutrition, and emotion. He was one of the first people to really talk about that triad. Chiropractic is a powerful tool. Adjusting can relieve, heard stories of, seizures stopping when they got adjusted, or, I mean, on and on, big, miraculous stories. The reality is the spine, much like acupuncture point. I mean, acupuncture, we could throw that under the bus the same way. I mean, if
Yeah.
they can keep needling the same points time and time again, if they don't address the nutritional deficiency of the lifestyle factor that's causing the acupuncture meridian to not function properly, or the C2 is going to go out, because of intestinal problems, then get adjusted like I did. I got adjusted C2, my very first adjustment. I felt great. And if I would have kept eating my, dairy and my wheat and the things that were offending my colon, I'd go back and get adjusted every other day and feel great for 2 days, and it'd be great for the chiros business. Chiros tend to have fairly strong
Right.
personalities as a class, so they're out there, sharing the word, and the adjustment is gospel and that sort of thing. It's a profound tool, but why? My challenge to any chiropractors that are listening: why is the subluxation there in the first place? Why do they need the adjustment in the first place? And it always comes back to nutrition, to toxins that they're exposed to, emotional triggers. I mean, even emotional stuff, we are more emotionally sensitive when we're minerally deficient or when we're not eating properly. The person that's eating the standard American SAD diet, they're going to be a lot more prone to take on, and be right at threshold anytime an emotional trigger comes down the pike. And so they're going to be a lot more, that's why chronic illness becomes such a problem for them, because now they've got emotion after emotion that's been stuffed away on top of, call it their nutritional deficiency. Yeah, I mean, to my peers, I mean, hopefully this will help empower them, to continue to look outside the box, to look at the, why traditional chiropractic says that the subluxation is the cause, and we keep adjusting until it sticks, and we're going to see it three
Yeah.
times a week until it holds. I wasn't happy with that answer, and I can nutritionally eliminate, if you will, a subluxation with a supplement, with a dietary change right there, and that would not come back. No, for example.
That's kind of a mic drop moment right there.
Beautiful.
Yeah,
Oh,
no,
really?
I like how, again, you've been able, I think, to bring it together for people to understand that, these things that all appear to be kind of separate, how they all kind of tie together and how one thing
Mhm.
leads to another. And ultimately, how getting to that root cause of what's really, causing the root cause of the issue, it will allow for true recovery, right? True healing,
Right,
not just
right.
putting a band-aid and making it feel better for a little while.
Yeah, blood pressure is a great example, right? I mean, just a shift, I threw some chiropractors under the bus, threw some acupuncturists under the bus. I mean, medically, right? Imagine trying to figure out blood pressure, right? There's many causes to why blood pressure can be high, right? My dad is not a heart attack patient, but the story was his heart was in, and he's still alive, but was inside, in backwards, and that he had open heart surgery when he was in his mid 20s. That's the scarring had started giving him some circulation challenges, backing up too far. Ultimately, he was having what looked to be a cardiovascular event, but I'd already known that he was having bloody nose problems. And so my first flag, when his wife, when I heard that they were evaluating him for the cardiovascular event, I'm like, don't give him aspirin. We already know it's more of a bleeding problem than a plaquing problem. Knowing these little things, the nuances will help us be a little bit more specific on what the triggers were for blood pressure, right? Is it a constrictive type of a problem, or is it an occlusive, plaquing, a plugging of the arteries? And I mean, really, how do we know? I mean, in the medical field, they can do, carotid ultrasound and things like that to look for, or coronary artery score to look for, where the plaquing is or how bad that is. That's one way, but look at some of these other mechanisms that go along so we can be holistic, really put the whole picture, treat the person, not the disease.
Wow. Can we go to, oh gosh, I think headaches are just so important here. I want to highlight one of the things you said. I know it sounds like my brain is going 40 different directions, but that's only
Great.
what it is.
Glad to do it.
You talked about other places that are commonly referred, other types of common pain. Headaches are extremely common. Low back aches, extremely common. And I was fascinated by aside from just the connection between the organ and the pain, the various places on the body that will manifest pain that all have the same root cause. Do you have, like, the most common one that I see in my office is kind of thing?
I get bored easy. My practice is very diverse. I'm a fitness junkie myself, so I mean that's the other part of the story. That's how I got into all this, because I figured better I understood the body, the better I could perform, better I could feel, function, and be. I mean, name an area of pain. I can give you some of the typical triggers. I mean, it's pretty diverse.
Behind the left knee on the outside. Not
The
that I
outs-
have any personal interest in this.
So the IT band, the muscle that goes down the outside of the leg, that muscle gets weak or compromised, conditionally inhibited when the colon is not functioning properly. So other symptoms that could go along with colon imbalance, we're talking about the outside of the leg. That's a colon concern. If it's more towards the back of the knee, that goes back to that popliteus muscle, where the Baker cyst, for example, that people sometimes get with a big cyst behind the knee. That's a gallbladder concern. That's a little different mechanism. Though the gallbladder could affect the colon, because if we don't digest fats properly, then the valves in the intestine, especially the ileocecal valve or the valve of Houston, those valves will close, giving the body more time to assimilate good fats, because we need those good fats. I mean, that's helped keep the cholesterol down. There's a whole nother, I opened up another can of worms with the cholesterol story. But when the colon doesn't function well, that causes that IT band to get weak. So we want to look at, is it because, eating too much dairy that's compromising the colon? Is there nutrient deficiencies? Is there a lack of minerals that create the bonding, the integrity of the intestinal lining? Is it further upstream? Is there a stomach problem? Then they would probably have a left-sided headache because of hydrochloric acid deficiency. So we take the other C2, sinuses is often a colon issue. The second cervical vertebra goes out, that can directly affect the sinuses, as well as just improper elimination, again, can set up chronic sinus problems. So similar deal. And if it persists, that's the warning sign, that lateral knee pain or the outside knee pain is an early warning sign that, hey, digestion's not working right. If we don't address it properly, then the long-term manifestation is things like arthritis and autoimmune conditions because of the compromised intestinal integrity there. So learn from, what's the trigger. The knee pain probably ebbs and flows or comes and goes a bit. So that's where we want to, maybe do a journal of some sort, that every time you eat pizza, the knee hurts, or tomatoes or that kind of thing.
Wow. I, that actually makes that this person on whose behalf I am asking would confirm that some of those things you mentioned very well could be related. So I will
Right.
share that information with him or her.
Okay.
You mentioned on your website a couple of modalities I've been exposed to ever so briefly that I just find fascinating. Neuroemotional technique, and I don't think you called it cranial sacral technique, but I think it's probably the same one.
Yeah,
Cranial
so
occipital or sacral occipital, I think is what you said.
sacral technique. Yeah.
Unpack either or both of those for our listeners.
There are several great approaches to addressing the mental, you know, s- it- the physical manifestations of emotions. And Dr. Walker, again, used acupuncture as far as to the best of my knowledge, used, historical acupuncture to identify specific emotions with specific glands and organs. We were just talking about the outer knee pain and its relationship with colon function. Emotions with the colon are grief and sadness, yearning, compelled to neatness, cloudy thinking. So it could have been that, hey, you lost a loved one, that overwhelming grief compromised the way the colon functions, and then you had knee pain ever since. So we may want to address the physical manifestations of those, and things like tapping, things like neuroemotional technique are ways, are modalities to help release the physical storage of those emotions so that that gland or organ can go back to normal, healthy function. That also positively affects the way we use nutrients. So if we get the emotional stuff corrected, then I find, for example, that people need far less supplements. I mean, I'm crazy conservative. Most of my patients are on, you know, I rarely give more than one supplement in a visit, and most of my patients are on five or less supplements total. Whereas, I have a buddy up the street. He's a great doctor, but he averages $800 to $1,000 in supplements every visit, that he's recommending for people.
Yeah.
And he doesn't do the emotional component. So when we clear the emotional stuff, the doses, the need for nutrition, the need for external supplementation tends to go down because we can address the underlying cause, the root cause, if you will.
That reminds me of a question I was going to ask earlier. What I understood is that there is this nutritional and emotional component as well as structural, I guess would be the word in chiropractic treatment. Do you find that these are all interrelated such that if you treat any one of the three manifestations, that the other two will settle down?
True. Yes. Yeah, and that's the art of healthcare, right? I get to the least common denominator, get to the most profound change for a person. That's the excitement for me, is helping somebody know, they may have a big list of symptoms, but tomatoes, are the main trigger for all of their problems. Hey, cut tomatoes out and let me know how much better you are. There can be triggers like that. Yeah, I was going to open the door to cholesterol and to high serotonin and some of these things, but
Hey,
Mhm.
I'm getting
Yeah.
cholesterol and high serotonin. Carry on.
So, I mean, we're running out of time, but just to broach the subject a bit, there's multiple cholesterol is often a compensatory mechanism as well. And
Right.
I mean, it's very well known that taking good omega-3s can help reduce cholesterol, right? Omega-6s can help thin the blood, function, almost like a medication would, to keep the blood moving thin better. There's all kinds of stuff, in the podcast arena and in the internet of, seed oils, and that's your omega-6s. Those seed oils, when they're as nature, when we're eating our nuts properly, they're not, roasted or compromised. Those oils can be okay. But if we get too much of the omega-6s, too much of the seed oils, and the gallbladder slows down, digestion slows down, we balance that out with more of the good omega-3s, fish oils and flax oil, chia seed, avocado, then that's going to help give the building blocks so that the liver, the body's not trying to overproduce cholesterol to compensate. A couple other typical mechanisms that can cause cholesterol to go high as a compensatory mechanism is hormonal deficiencies. If a gal doesn't have, or a person doesn't have enough testosterone or enough estrogen, then the body will overproduce cholesterol to try to compensate, to give the building blocks. Cholesterol is the building blocks to most of the hormones. And so if there's a deficiency of one of those hormones, or one or more of those hormones, the body may overproduce cholesterol to then, as a way to try to compensate for that deficiency or that weakness. So often I'm helping, the ovaries function better, for example, to help bring cholesterol back into a healthier range. So that's a very typical mechanism. Similarly, because hormones and the thyroid gets a lot of its feedback from hormones, similarly, hypothyroid can often cause higher elevated cholesterol as a compensatory mechanism as well.
Okay, Phil, this is definitely going to be a chapter 2 and or a chapter 3. I can
Definitely
tell.
so. I can verify a lot of what Scott was just talking about, low thyroid, for instance, being definitely a factor in what are called high cholesterol levels, and lots of fascinating associations for us to explore. But maybe if people don't want to wait for when we get you back, Scott, how can they find you? How can they find out more about you? And certainly tell them about the book as well.
Thank you. Yeah, the book is called The Headache Advantage because we want to take advantage of what that pain is trying to tell us. It's available on Amazon, or headacheadvantage.com is the website. If you can spell my last name, you can find me on social media, that stuff. That's my last name is Vrzal, V as in Victor, R-Z-A-L, Vrzal. So drvrzal.com is my website for the office. You can find links to the books. I'm not a big social media guy, but I'm out. I'm on Instagram and Facebook, TikTok, that sort of stuff, with fun little quippy health pearls. If you can spell my name, you can find me on those social media platforms as well.
Fantastic. All right. This has been really interesting to me, and I can tell you're somebody I just want to pepper with questions. And so we're gonna officially agree right now that we're gonna have you back. Yes, Phil?
Thank you.
Nod your head, Phil. Thank you.
Appreciate it.
We'll make sure that all the Dr. Vrzal's contact information is posted in the show notes. And until next time, this has been Stay Off My Operating Table with Dr. Philip Ovadia. Thanks for joining us. We'll talk to you all soon.
Chances are you wouldn't be listening to this podcast if you didn't need to change your life and get healthier. So take action right now. Book a call with Dr. Ovadia's team. One small step in the right direction is all it takes to get started. Contact us at ifixhearts.com/talk. That's ifixhearts.com/talk.